Hi everyone, welcome back to my channel. Don't forget to subscribe my channel and press the bell icon. In this video, we will see in detail about chest pain. Chest pain is one of the most important emergencies. Therefore, it is necessary to evaluate chest pain. It could be as serious as myocardial infarction or just muscular pain. Always think first and rule out life-threatening conditions such as myocardial infarction, aortic dissection, pulmonary embolism, and pneumothorax. History is very important. Ask whether it is acute and ongoing pain, recurrent or episodic pain, or persistent pain even for days. Let's start chest pain due to angina pectoris. Angina means discomfort. Angina pectoris is usually described as heaviness, pressure, squeezing, or sensation of constriction in the chest, but it may be prescribed as aching or burning pain, difficulty in breathing, or even an indigestion. In order to take good history, you should know the difference between stable and unstable angina. Anginal chest pain may be typical or atypical. Typical pain of stable angina is the pain that develops gradually during exertion, after meal, with anger, excitement, frustration, and other emotional states. It is not precipitated by coughing, respiratory movement, or change in position. Anginal pain typically resolves within 5 to 30 minutes. More prolonged pain represents myocardial ischemia, while more prolonged pain without evidence of myocardial ischemia suggests a non-cardiac pain. Anginal pain disappears usually after rest or within 5 minutes when sublingual nitroglycerin is used. Angina typically occurs in retrosternal region, anteriorly across the mid-thorax. It may radiate to or rarely occur alone in the intrascapular region, arms, shoulder, teeth, or abdomen. All these features of pain represent ischemic pain due to stable angina, while the pain of unstable angina occurs at rest, may be atypical and less responsive to nitroglycerin. Atypical chest pain may be due to ischemic heart disease, especially unstable angina. However, it is less likely to be cardiac in origin. Atypical chest pain may present as sharp or knife-like pain brought on by respiratory movement or cough. Pain that has primary location of discomfort in the middle or lower abdominal region. Pain that may be localized at the tip of one finger, particularly over the left ventricular apex. Pain produced with movement or palpation of the chest wall or arm. Constant pain that persists for many hours. Pain that radiates into the lower extremities. Next we discuss chest pain due to myocardial infarction. Pain of myocardial infarction is similar to angina in distribution, but it is of longer duration and is usually of greater intensity. In contrast to stable angina, it is not relieved by rest or sublingual nitroglycerin. It may be accompanied by nausea and hypotension. Diagnosis and plan of management. History is very important. Ask about risk factors for myocardial infarction, such as hypertension, smoking, diabetes, and strong family tendency. Decide whether the pain is typical or atypical, acute ongoing pain, recurrent or persistent pain. Examination is usually unremarkable. In ECG, depression or elevation of ST wave. Investigation include ECG, chest X-ray, X-ray of spine, shoulder or rib, echocardiogram, CT scan of chest, upper gastrointestinal endoscopy. Following investigations may be considered to identify the cause of chest pain depending on clinical assessment. Chest pain due to pericarditis. Pericarditis is inflammation of pericardium. Pericardium is a thin sac that surrounds the heart. Visceral pericardium and most of parietal pericardium is insensitive to pain. Therefore, pain associated with pericardium is believed to be due to inflammation of adjacent parietal pleura. Pain due to non-infectious cause such as myocardial infarction or uremia is mild, while infectious pericarditis causes more severe pain due to spread of infection to the neighboring pleura. Pain due to pericarditis may be felt at the tip of the shoulder, neck, anterior chest, upper abdomen or back. Pericardial pain is aggravated by cough and deep inspiration because of pleural irritation, change in position and swallowing. It becomes sharper and more left-sided in spine position and milder when patients sit upright and lean forward. In some patients, pericardial pain is steady. Retrosternal discomfort mimic the pain of myocardial infarction. Chest pain due to pulmonary embolism. Infarction of a segment of lung that is adjacent to the pleura commonly irritate pleural surface and cause chest discomfort. It may resemble the pain of myocardial infarction. Chest pain due to esophageal causes. Esophageal spasms due to reflex esophagitis cause wheezing pain that mimic pain of myocardial infarction. It may have similar pattern of distribution. History of heartburn and food regurgitation are important clues. A number of children come to cardiac emergencies with chest pain that is usually due to esophageal spasms as a result of eating groundnut. Chest pain due to musculoskeletal disorders. Localized tenderness is common. Pain may be sharp, lasting for a few seconds, or it may be dull that persists for hours or even days. Pain is variable in size and intensity. There is no definite pattern. It may be vary with posture or movement, but does not cease instantly on rest. Pain due to cervical spondylosis is very common. Local tenderness over rib or costal cartilage is usually present. Next we discuss chest pain due to aortic dissection. Hypertension and Marfan syndrome are the most common predisposing factors. Patient is usually old, presenting with severe tearing chest pain radiating to intrascapular region, not responding to anti-anginal treatment. Pulse may be unequal. Lastly, we discuss chest pain due to emotional cause. Emotional disorders may cause chest discomfort in the form of chest tightness lasting for half an hour or more that is unrelated to exertion. It may be sharp and very brief. This type of pain is also called precordial catch, effort syndrome, or Da Costa syndrome.
Thank you for watching. Please like, share and subscribe.